how does your non-invasive system estimate intracardiac pressure?
Yeah, absolutely. So we've built what's called a SAVE sensor system. And just to go back a little bit, the name Acorai comes from a combination of three words. So acoustic, core, and AI, which represent what we do, right? We're listening to the heart with AI.
Yeah.
And we're listening with 4 different types of sensors, something we call the SAVE sensor system. And SAVE is another acronym for the 4 different types of technologies that we use. So seismic, acoustic, visual, and electric sensors. We've borrowed heavily from other industries to kind of come up with this combination of sensors and the exact location of these sensors and how they interact with the exterior of the body, and to collect signals with as high fidelity as possible. But the way the device works, you simply place it on the patient's chest. It has a multimodal sensor platform. The seismic sensors detect very small chest wall vibrations on the surface of the skin. The acoustic sensors are effectively, you can think of them as our own highly optimized electronic stethoscopes, which focus on a slightly different frequency range than your typical heart sounds. We have visual sensors, so PPG sensors that look at the capillaries of the chest region. And then we have ECG, sort of a workhorse of cardiology, right? Which is more there to time the cardiac cycle to make sure that these sensors are aligned. We then fuse these time series sensor data sets, and we identify patterns in that data set using machine learning. And at this point, we've built a global data set of over 2,000 patients that have all undergone a right heart catheterization procedure, which is the gold standard for measuring these pressures invasively, right? So a very high quality data set, very large data set, and diverse across 6 countries, which is what's allowed us to build a device that collects data with a high degree of fidelity and quality, but also allows us to estimate these pressures non-invasively.